All right, we're going to go ahead and get started here today. I want to thank everyone for attending 10 HIPAA requirements you're not meeting, right? And when we think about HIPAA, if you're having trouble sleeping at night, it's a great article of laws and requirements to read that'll put you right to sleep. They're extremely confusing, and there are a lot of conversations that I've had, as well as many of the guests that are going to be attending today's webinar here have had with healthcare organizations. There are things that people just don't understand, and they're certainly not meeting in terms of requirements. So that's why we're here today to talk about 10 of the more outstanding or popular items that organizations struggle with in terms of meeting those requirements. The first one that I want to kick things off with is HIPAA security and awareness training. Number one. Now, to talk about this particular topic, I'm going to bring in a friend of mine, Sarah. Now, Sarah is a great example because she works for a healthcare organization, and her job requires her to handle electronic protected health information on a daily basis. Electronic health information is also EPHI. Now, Sarah is everyone's favorite coworker. She comes into work early, stays late, always gets her work done, extremely friendly, and she even brings in fresh baked brownies from time to time. But Sarah's also a very intelligent person. She uses common sense most of the time when she's performing her job duties, right? But Sarah never received any type of formal HIPAA privacy or security training. So when she received an email that looked like it had been sent from her boss asking her to download a couple of forms and fill them out, she did. In doing so, what she actually did, though, was download a ransomware virus that infected all of the organization's EPHI, ceasing business operations. Yikes. Now, let's take Mark. Mark, to be blunt, sucks as an employee or coworker. He has a new excuse every week for why he's late, and people pretty much just do everything and anything to avoid having to work with him. Like Sarah, Mark's job also requires him to handle that EPHI on a daily basis. Now, aside from having two completely different demeanors, there's another key difference that I want to point out between the two of them. Mark's company makes it mandatory that all new employees go through some formal type of security and awareness training before they can actually begin performing their job duties and dealing with that EPHI. In addition, those employees at his company are subject to go through that same training at least once every year. So while the odds were a little bit slim that Mark was actually going to do what his boss was seemingly telling him to do in that email, Mark remembered that overly enthusiastic cartoon character from the training video that he watched earlier that year talk about potential warning signs of phishing attacks. So before opening that email and noticing that something wasn't quite right, he informed his superiors of the suspicious email, which actually turned out to be that phishing attack that contained some type of malicious code in it. So this is a very obvious example that I'm talking about right now. But the point that I'm trying to make is you would be surprised how many healthcare organizations don't actually conduct some type of formal HIPAA security and awareness training. Now, there are a plethora of resources that are free or extremely affordable, and it's important that your employees know when to properly disclose EPHI, how they're supposed to do it, as well as how they're going to protect it, meaning one of those components might be being aware of potential phishing attacks. Not to mention, HIPAA requires you to do some type of security and awareness training. So for Sarah's organization, if they were to have been subject to some type of a breach as a result of that ransomware attack, or they went through some type of an OCR audit, they would be found negligent from not having their employees go through this type of training and it could significantly increase any potential fines, as well as conducting training and making your employees aware of what they're supposed to do, how to disclose EPHI, how to protect it. It's just going to be better business for you, so you don't have to deal with that issue. So number one, security and awareness training, something that you guys have to be doing. Now, my second topic, termination procedures, we're going to go back to using Mark as an example, not Sarah, Mark. Now, Mark, as I mentioned, he isn't the greatest employee. In fact, his performance has been so unsatisfactory to his organization that the organization has decided to separate ties with him, or basically terminate him. Now, as I mentioned before, Mark's job, right, entails or includes him dealing with EPHI, providing him with access to any systems that contain that EPHI, or any type of EPHI that he has to deal with, maybe it's PHI, regardless. If he's dealing or has access to these systems, what's important is that upon deciding to terminate or sever ties with this employee, you need to go through a formal process to document termination procedures, meaning what you don't want to have happen is Mark gets fired, he goes home, he's already a crappy guy, he hates the organization, and is extremely mad at them. He has access at home to those systems that contain that EPHI. So Mark decides he's going to go home, and you know what? He's going to download a bunch of that information, maybe leak it or try to sell it on the dark web, something along those lines. Well, if your organization hasn't immediately shut off access or doesn't have policies in place, to perform those activities, then Mark's going to have the opportunity to go home and do some type of harmful activity, right? So it's important too, if Mark goes home and somehow, some way, or before he was fired, he had captured or stored a bunch of that EPHI somewhere in the event that maybe he foresaw himself being fired here shortly. What's important as an organization is that you go through that formal process to terminate, right, and shut off access for Mark after you fired him, and then document that you've done those in a reasonable time frame so that if there is any type of an incident that occurs as a result of him being fired, okay, and you guys are brought into litigation, you want to be able to go back and actually show that documentation of your organization doing its due diligence ahead of time. So that's number two that we want to talk about, formalized termination procedures. Make sure you have them in place. Make sure you document them anytime that happens. And this is the same thing if an employee even resigns, right, and they're not forcibly terminated. Regardless, formal termination procedures, and you have to document that they're actually being done when you do them. Now, the next component or topic that I want to discuss, I'm going to bring in our first special guest today, Jake Wagner, to help me discuss the next couple of topics. Jake is a strategic business advisor at Collabrance, and Jake wanted to introduce you as well as give you a second to just talk about, what is Collabrance?
Hey, JP, thank you very much. Good afternoon, everyone. I think that first things first, strategic business advisor, that's a fancy title for sales. So I'm in sales at Collabrance, and so my job really comes in two parts, JP. So Collabrance is a two-ring live answer, outsourced knock and service desk. So when you think about a typical office equipment dealer today looking to get into delivering managed IT. So by the way, everything that we're talking about today as it relates to IT and cyber, your MSP, your managed solutions provider should be doing these things for you today. So whether you're an office equipment dealer looking to get into managed IT, Collabrance has a path for you to go to market faster, more efficiently. And then if you're an existing MSP today, so an existing managed solutions provider, perhaps you're looking to jump to that next level of operational maturity. Again, Collabrance has an onboarding process and a sales process that we feel is incredibly effective. So at the end of the day, we're helping people get smarter with technology, which is why we're here. And JP, I think that, we're going to be talking about network monitoring. Is that correct?
Yeah, and you know what, even Jake, before we get into network monitoring, the third topic and a lot of what you guys do in terms of managing technology, right, Data storage and the management of that data is a pretty heavy topic to discuss. I've talked to a lot of healthcare organizations, Jake, that some of them actually choose to manage their own servers on premise. They store them on premise. What are some of the challenges or risks in taking that approach as opposed to, perhaps using an MSP that stores their data in servers, in a more secure area? Can you just kind of talk about what are some of those risks to, trying to tackle this component yourselves instead of looking for some help?
Yeah, absolutely. So when it comes to backup, right, and when we're having these conversations on a very regular basis, first of all, the words manage and the words support, I believe people use them very loosely. Those are very subjective terms, and it really comes down to really understanding, okay, great, you are managing our backup, or great, you are supporting our backup, but what do those words actually mean? And today, more than any, right, and into the future here, this stuff is getting more and more complex and more dangerous. So I think to bring this into real life, by first of all hosting your data internally and relying potentially on some internal IT to manage this stuff, again, we want to understand what are they and what aren't they actually doing. So it's one thing today, JP, to say, yep, I've got backups, my guy, right, or my girl, they show me we've got backups. It's another thing to prove that they work, okay? And so these solutions today aren't set it and forget it. You don't stroke a check and hope and pray that it works. It takes day-to-day babysitting is probably the best way to put it. So by hosting really anything on-prem today, you're really subjecting yourself to your internal resources. So alternatively, you could be hosting a solution internally, also exporting this information out to multiple data centers, East Coast, West Coast. So you want to get out of the day-to-day, the manual backups first and foremost. You want to get to something that's very automated. And I truly believe you're looking for a trusted brand today, a bigger name as opposed to cobbling a solution together. And just I suppose a real life example, and I'm sure Paul could probably touch on this in a little bit, but unfortunately, as we were just about to last week begin working with an organization that had recognized the value, they were today managing their backups internally. Unfortunately, with just a click of the button, right, an uneducated user let in the bad guys. And the bad guys are sitting there, they're salivating, they're waiting to come in and take over an environment. So I'm assuming everyone's heard of malware, right? But this organization ended up getting infected, is a simple way to put it. All of their data, JP, locally, because that's the only spot it was stored, all of their data was encrypted. Therefore, that business is not operational today. It hasn't been operational for about a week. And so here they are sitting, really looking at hitting the hard reset button. And any sort of restoration at that point, when you're dealing and negotiating with criminals, that doesn't usually bode well for all parties, right?
Absolutely. And plus, Jake, I'm sure you can talk, to not only are some of the benefits of kind of outsourcing that component of the organization, right, but it's probably cost effective too, because maintaining those resources in-house as well as, having somebody who's a full-time employee, one or more employees, right, to support those efforts can be extremely costly to the organization as well, instead of outsourcing them, correct?
Yeah, absolutely. So there is, again, today, just alluding to the fact that your IT solutions today are far more complex than they were yesteryear. And going into the future, we only, it's inevitable that things will continue to get more complex because the cyber landscape continues to become more dangerous. And the bad guys are getting smarter. And so when you think about if you're a standard healthcare provider and you're considering hiring internally, there's a lot of implications today of putting all of your eggs in one basket or maybe two baskets to hope that these guys or girls understand every single aspect and intimately understand the overall solution. Just 2, potentially 3 resources internally. Not only is it expensive, but it's really wishful thinking, as opposed to finding a provider that can bring multiple resources to the table, achieve those economies of scale, and ultimately has the credibility and the expertise to be specifically managing those backups, both on-site and off-site. And again, it's not It's not a matter of do you have clean backups today? It's do you have an actual business continuity plan? How soon can you actually get back up and running, right? And these are all operational costs to consider when making these decisions now and into the future.
Absolutely. Jake, the next component or topic that I want to talk to you about is network monitoring. Can you just briefly explain or give the audience just a brief explanation in terms of what network monitoring really is?
Yeah, so from my perspective, JP, and certainly from a sales perspective, network monitoring to me means having our eyes and ears inside the network on every single endpoint, so we know the ins and the outs. Security today, it's multi-layered. It has to be multi-layered because there is no silver bullet for this. And so obviously at the very front, right, you've got your firewall, you've got your servers that firewall is protecting. What we would define network monitoring is it's remote monitoring and management. So it's a tool, it's the eyes and ears on every single endpoint that understands the day ins and the day outs from a hardware health perspective. Now, and if you compare that to a vehicle, it's how's the engine running, right? What's the PSI of the tires, et cetera. Now, there's multiple forms, or excuse me. So did that answer your question, JP? Just simply put, what network monitoring is as far as eyes and ears?
Yeah, absolutely. I think to the audience, they certainly understand a little bit more about what that network monitoring means. When you say endpoints, Jake, can you just verify what you mean by endpoints?
Yeah, so our policy, one of the best practices that we follow at Collabrance is really anything that's touching the work network needs to be a trusted device. So when you think about your Wi-Fi today, I won't go down that rabbit hole, but an endpoint today, it could be your phone, it could be an iPad, it could be a laptop, tablet. It's your workstation, and it's the server. So really anything that's touching the network today is a node or an endpoint. We use those terms kind of synonymously.
So basically, when you talk about that network monitoring, right, it's making sure that those endpoints or the users that are connected to those endpoints, right, are who they say they are. There's nothing suspicious happening or occurring on that network that is maybe out of the ordinary and could potentially be some type of an outside source or an intruder trying to break in and obviously cause some havoc. Correct?
Yeah, yep, JP, and I think that's a nice transition into maybe the next segment that we want to talk about as far as what are some different solutions, right? What are some different network monitoring solutions? So at the most basic, I'd mentioned the RMM. That is the simple tool of monitoring the network's health, and we want to make sure that RMM tool is on every single endpoint. And you're correct, we're tracking those devices then first and foremost. Now there are additional layers, and today we want to say that they're required. Okay, so Collabrance partners today use some other tools as well. And again, I don't want to go off the technical deep end. So at a high level, we call it a SIEM solution, and that acronym is an SIEM. And this is essentially software that we put on at the firewall level. So at the very front, when you think about all the bad guys are sitting out there in the internet waiting for you to connect to the internet, and then they're going to follow you back into the network. So that firewall, to a certain degree, is keeping most of those bad guys out. But if a bad actor happens to get in today, each and every day inside of a network, when you think of every move of a mouse or click of a button, every keystroke, anything and everything that you're doing on your workstation creates a log, L-O-G. So it creates a log. And there could be tens, if not thousands, if not millions of logs, depending on the size of your organization. And what the basic monitoring tools that we just touched on, what they don't do is keep track of all of those logs. Now, these logs are occurring inside of the network. This SIEM tool, SIEM, this SIEM tool is really powered by AI, and it has the ability, the computer has the ability to take a look at these tens, thousands, millions of logs, and it puts together a puzzle. This is the way I simply explain it to folks. It puts together a puzzle that no human could ever, with no amount of time or unlimited resources, a human could never put this puzzle together each and every day, every single moment. But this AI, this machine, has the ability to piece together this really complex puzzle that it says, hey, this kind of looks a little fishy. And when it looks a little fishy, meaning that maybe there's some bad actors, there's something that's a little different today that's going on, it pings a security operations center. So through Collabrance, it's notifying one of our high-end system security engineers, And that is when human eyes actually take a look at this puzzle that the AI put together and says, is this true? Is this something we need to take action on immediately? Or is this a false positive, and on we go? And now we've learned something additionally about this network. So the third one, and I don't want to overkill this, but the third one that our partners are using, and potentially Paul could talk about this coming up, but one of the tools that we heavily encourage is by an organization called InfoGPS. And so this tool has the opportunity, has the ability. So it's agent-based, and really what it's going out there and doing, JP, inside every single device. And you mentioned, right, you had Sarah, and what was the other gentleman's name? Was it Mark? You had Sarah and Mark, and you're talking about their network hygiene, basically, is how I describe it. How are they using their computers? How responsible are they? So this additional layer of network monitoring, this tool called InfoGPS, is agent-based. And what it allows us to do is go into each and every network, not only at the onset, but on an ongoing basis. And really what it's seeking out on each and every workstation is what we call PII, or personally identifiable information. And that's basically any data that could potentially identify a specific individual. So credit cards, social security numbers, insurance records, et cetera, et cetera. And when you think about today, JP, because God forbid, people are a little reluctant on upgrading their workstations, right? They want to buy it and they want to run it as long as they can. Over a 3 or 5 year period of time, there's a significant amount of information that can be stored on those workstations. And so it's also just really relevant for any organization out there today to understand where all of that information potentially could be hidden, and also how much it's worth on the dark web, because the dark web is real. It's a very real marketplace for bad guys to be selling that information. So again, at the basic level, we want to have our eyes and ears. At a more sophisticated level, we want to be putting together that puzzle, that massive puzzle of all of those logs day in, day out, and to take it a step further and understand who potentially resources within an organization, key employees or decision makers, what workstations would potentially be most targeted by the bad guys on an ongoing basis, and we want to take additional security measures to protect them. So,
absolutely. Well, Jake, certainly appreciate you taking some time today to talk about these couple points. And as I mentioned before, right, these are requirements of HIPAA. We want to make sure that the audience understands what these requirements are. So, Jake, you've been a great resource, and appreciate your time today, and look forward to future conversations about these subjects.
Yeah, thank you, JP.
Thanks, Jake. For my next topic now, as Jake had mentioned Paul Hugenberg a couple times of InfoGPS Networks. Paul's going to come in and talk about risk assessments, right? Gotta love them, love to hate them. Paul, how are you doing today?
I'm doing great. How are you doing?
Doing wonderful. Paul, I feel like a lot of healthcare organizations don't know that they're actually required to conduct, a risk assessment. Can you just first describe, what exactly is a risk assessment, and in your opinion, why do you think that HIPAA mandates that healthcare organizations, go through this event or activity?
So great question. So we'll start out with just restating how you introduced the topic, and that is the risk assessment activity is a required activity under HIPAA, and that requirement is annually at a minimum. And anytime there are significant changes to your environment, the risk assessment is highly suggested. So sometimes it happens more than annually. That's important to know because the why in the HIPAA mandate has two sides to it. The first being your legal requirements to adhere to the standard if you're holding electronic patient information. So organizations who skip the risk assessment process and then subsequently have issues or suffer a data loss event, and God forbid what we would legally call a breach, the lack of a risk assessment is going to be viewed in very poor light from both an insurance coverage standpoint as well as in a response to any type of suit that you may have. And most certainly, if the OCR comes in from a compliance standpoint to respond to the breach and you do not have a risk assessment in place, the fines are going to be swift, quick, and high. So let's just revisit that it is a requirement. We need to be doing it. The second reason why it's important is because the idea of an entire industry that is looking to protect certain pieces of EPHI operating kind of from their own view and own approach to how to understand if they're doing the right things and if they are focusing their dollars and efforts in the right areas. You can imagine that you come up with a whole lot of different methods to do this and a whole lot of different conclusions to do this. And it's very hard to have an objective evaluation of whether or not you're doing what you ought to be doing. So the mandate for the risk assessment is fundamentally based on the guidance provided from HIPAA, which refers you to the NIST risk framework. I can also refer you to ISO. So basically, any commonly commercially available tool that is performing a risk assessment framework can be used. So what this does is it allows you to approach the risk assessment process in a formatted and structured fashion. So everybody is doing basically the same thing, and thereby we can rely on the results when we compare organization to organization. Now, I think you asked, what is a risk assessment after the why? And since we know why we have to do it from a compliance standpoint, we know why we have to do it legally. Frankly, it is a very good way to make sure you're spending dollars in the right way. Anyways, you should be doing it regardless. What the risk assessment is meant to tell you is where you are at risk of some sort of exposure point. And from a HIPAA standpoint, what we're literally talking about is the loss of electronic private health information or the unauthorized viewing of electronic health information. So how do you protect that? Well, if we follow a standard format, we can begin to go through, known threats to that information. We can begin to go through known controls that we have in place over that information and end up with a conclusion that allows us to say, hey, we're doing pretty good. We've covered our stuff. We think we're spending the right amount of money. We're willing to move forward with this framework, or we have some severe gaps that we need to begin to address relatively quickly. So that risk assessment helps you answer that question. And it helps you answer it in an objective fashion.
Okay, now, Paul, let me ask you: is a risk assessment something that an organization can, do themselves or conduct internally?
So that's a very good question, and that's a common question as well. So the short answer, the black and white, is yes. An organization can do a risk assessment internally. What they cannot do is outsource the conclusions of risk to a third party. They can do it inside. If they hire a third party to do it, they still have to make the decisions of risk. But let's kind of evaluate the value of somebody attempting to handle the risk assessment process inside without some external expertise. So this really kind of comes down to what type of talent and skill sets and personnel do you have inside your organization today. And if you have an IT professional, an information risk professional, risk assessments are going to be part of the normal recipe that makes up their skill set. And they're going to be very aware of what the risk assessment should include and how to go about it. And likely they're going to be either informed or have the resources to become informed to get this done. In reality, we find that typically around 7 or 8 out of every 10 organizations do not have that type of skill and expertise in-house, and they really need to look outside to get it done. So, remember, if you are in the HIPAA world and you are holding EPHI, EPHI can literally be the biggest financial risk that you have in your organization today, even larger than maybe the size of your balance sheet. And so the ability to perform a good assessment and understand whether or not you are protecting your organization from this tremendous risk, and the patients that trust you, a lot of times you just have to say, I'm over my head. I know where my limits are, and I need to bring in somebody that can do this, has done it several times, is probably very efficient at it, and can give us some real world answers. So yes, you can do it internally. I do not suggest it unless you have a professional inside.
So then in turn, right, when we talk about looking for an independent party or third party to do the risk assessment, on behalf of your organization, what are, you touched on some of those benefits, but is there anything else that you would at least comment on in terms of the benefits of outsourcing that activity to a third party agency?
Sure. So, in this space, obviously, we're dealing with regulatory problems. We're dealing with legal liability problems. We're dealing with the potential of being sued by partners, vendors, clients. And so just like in any other major business aspect, we hire a CFO when we need something managed on our books to understand the complexity of it, put it together the right way. We hire an attorney to review contracts and make sure that the clauses and language that we're using is going to afford us the most likely objective of that contract that we're looking at. We're not going to get caught when there's trouble. So the risk assessment portion is the same thing. So hiring an outside expert is going to give you obviously some comfort, some peace of mind. It's obviously going to take some of the logistics off of your shoulders as you are going to be responding to questions and interviews as opposed to actually sitting down and doing it. If you typically use software, to do the risk assessment, to record the documentation, that software has been built to standards. And so it helps make sure that you're covering the right areas. And that software generally comes with a third-party assessor. Right? They're going to bring in tools to do that job much, much quicker. So, it just really becomes an area where, IT changes every day. Most operational shops are not IT shops. That's not why they're in business. That's just not where their skill set lies. Most IT assessors aren't doctors, right? And so we kind of do what we each do best, and we help each other get to a common objective. So third parties are really kind of where you want to be going. And fundamentally, if we take a look at it from a liability standpoint, again, when something happens, the control structure that you have in place and your ability to evidence that you have done what you should do to a reasonable level is going to be based on how you perform those steps. And so did you do something you didn't know how to do, you did it poorly, or did you hire people that knew what they were doing, you trusted experts, you made educated decisions, and things went bad, but it wasn't because we skipped on our responsibilities. That third-party assessor is really going to help you leverage that comfort as well.
Great. So, Paul, would you think that it's also safe to say that if it's something that you're trying to tackle internally, a lot of times you can come to almost a biased conclusion because you are looking at your own organization, and whether you don't have the subject matter expertise to truly conduct a thorough risk assessment, you may be biased towards the way that you answer some of the questions pertaining to the risks of the organization and what you're actually doing.
Oh, absolutely. So just by human nature, individuals are less likely to point out where they are short in reaching some levels of responsibility, adequate coverage over areas that their duties entail. So an independent party has always been a primary discipline within any type of compliance or business operation. Anytime you can interject independence, you also interject a little bit of validity, and you also interject a little bit of comfort in the results.
Great. Now, Paul, to kind of switch gears just a little bit here, want to talk about malicious code protection. And, Paul, other than, malicious code sounding like it's something bad or maybe something that you wouldn't want to contract, what is malicious code and what are some examples of that?
Well, it is bad, so the title should be good. So malicious code, is any type of, it's referencing any type of software or application or small lines of code that can execute or operate on a computer system that performs something that you do not authorize it to perform. So we can think of malicious as it bricks my device, it makes my device unusable. We can think of malicious code as it steals keystrokes. We can also think of malicious code as it spreads ransomware. So malicious is really the software or the executable is doing something that we are not authorizing it to do, and it causes us some concern with either the confidentiality of information, the availability of services to us, or it changes data, it alters the integrity of our information systems. That's what malicious code is. It comes in a couple of different flavors, right? So malicious code could be a virus, and we are all kind of comfortable with the definition of a virus. I'm all of a sudden getting just a ton of pop-ups on my machine that weren't there before. I'm getting ads to things I don't want to see. My machine is booting very, very slowly. Excel doesn't work anymore, right? So viruses make our machines sick, right? I.e. the term virus. It could also be malware, things that are actually making changes to the system that we don't want, and that may or may not be transparent to us. We may not know that it's happening. The most common type of malware that we see today, and it's really, what is the front of the headlines, is ransomware. So when we talk about malicious code, the way that we see malicious code today in its most tangible representation is, somebody clicking on an email, introducing a thumb drive to an environment that should not allow thumb drives. There is code on that thumb drive or in that email. It is downloaded transparently, that is without the knowledge of the person reading the email or using the thumb drive. It's installing on the endpoint, and then it is making that endpoint inaccessible by encrypting all of the data on it, then asking you to pay some amount of money or Bitcoin in order to get a detection key to get your dollars back. That is probably the most aggressive type of malicious code today, and it certainly is the most damaging.
So then, Paul, HIPAA mandates, and if you read the actual HIPAA citation, it says that as an organization, you're responsible for protecting the organization against malicious code. How can healthcare organizations, implement these protective measures? What do they look like? I mean, how can they go about doing that?
Great. So just to revisit, right, you started that question with HIPAA mandates that organizations protect themselves from malicious code. That means if you suffer from malicious code, by definition, that is a HIPAA reportable incident. So if you are a HIPAA regulated entity storing EPHI and you suffer a attack of malware and specifically the more dangerous ransomware, you have suffered an incident under HIPAA, and that's a reportable event. So we want to get ourselves out of that cycle where we have these reportable events, where we're kind of putting ourselves in a compliance posture that's a little bit riskier. So how do you protect yourselves against those? Well, there's layers, as Jake had talked about, in terms of what you put around your network to solve certain problems. So let's talk about a layer. A layer would be end user awareness training. Do your employees understand how to use the technology you've given them? Are they allowed to access personal email? Do they understand your policy says not to click on attachments? So you train users on how to use the technology. That's one way. Now, people make mistakes, so they click on things. And assume that they click on an email that has an attachment with malicious code in it or malware in it. Are you running anti-malware or endpoint protection software on that endpoint, on that server, or on that desktop or laptop? That means if they click on email, then when the software is downloaded, the endpoint protection has a high probability of recognizing that that's occurred, and it stops the activity right in its tracks. Acts just like a quarantine type of software, gets it away from you so that it doesn't harm the individual. Another layer would be the outside talks to you through a firewall. Does your firewall inspect emails and packets before it even gets to your user and removes email that has dangerous code in it and your user never sees it? And so you can see there are different things that can be done before you come in. Most important is we never recommend, and we certainly would require if we were doing an audit, that you have some sort of endpoint protection software on your endpoints. So we have to assume the email gets clicked. We have to assume the employee reads it, and we have to assume that that software hits the endpoint. So we need to stop it as soon as it's there. Now, so that all that stuff fails and there is ransomware. Well, as Jake mentioned, are you backing up data? And do you back up data routinely? And do you store it off-site so that it's not on the same network? So if you do suffer from a malware event, we now have the ability to go to a backup and probably restore something that's clean. And it's a hiccup instead of a frustration. It's a couple hours instead of, as Jake mentioned, a week. So when you start to talk about protecting, what you want to do is say, how can I get this and do I have a control? If that is breached, how do I stop it automatically? Do I have a control? If that doesn't work, then do I have a way to recover, and do I have a control? And just put those in a line and make sure that they are set and ready to go.
Awesome. Now, Paul, kind of moving on, let's talk about from malicious code protection to what happens when there is some type of a security incident. First of all, what would you classify an event as a security incident?
Great. So before I answer that, I'm not sure if Jake is still on the line, but Jake has heard me say this a number of times. Anything that happens in an environment, we want to classify as an incident. We never want to classify it as a data breach. We want to leave the lawyers to do that, as it kind of puts us in a position of requiring a certain response. So we're going to talk a lot about security incidents, inside an organization throughout the course of a year. So a security incident would be anything that happens that is out of the ordinary, that would disrupt the confidentiality, integrity, or availability of regulated content, or content that you think is extremely valuable to your organization. So let's say somebody forgets to put in the correct password 3 times and they're locked out, and your information security officer gets a warning that Paul is locked out. That's not an incident. Okay, that's just kind of typical operations. Our controls are working. Now let's say that information security officer gets a warning that Paul has been locked out 22 times today, continues to happen. That's probably something that we want to call an incident and begin to look at it, because something out of the ordinary is happening, and it's happening outside of our typical control structure, and we got to worry about it. So really, it's what is occurring that is normal. Can we identify what is abnormal or other than normal, and then we classify those as an incident. This is by definition going to be something that's outlined in your incident response policy or your security response policy. We are going to denote what we think is an incident so that we know how to respond. Is that clear?
And Paul, I'm sorry, Paul, that brings up another great question. To your point, describing method, or what are some methods or processes for responding to a security incident? But even before then, how do you even qualify that an organization is truly capable of effectively responding to a security incident?
So another great question. So let's start at the beginning. Do you have a security or an incident response policy? Have you set the expectation at the top level? Does the components of that policy really outline what's an incident, what isn't, and how we are going to respond to it? So what we're trying to avoid is, a general's last ride where everybody is trying to fix something but nobody is working together. We want a concise, stable, deliberate response. So start, do you have a policy? Now, what's in that policy? Does that policy say incidents are going to be reviewed by an incident response team, a collective group of people who can evaluate what just occurred? That may include your information security officer. It may include corporate counsel. It's people that have the ability to make quick decisions in your organization and are authorized to do that. So after you've got this incident response team identified, then it is the steps of how you respond to an incident. Are there forms that get filled out? Is there a communication chain to get a hold of these people? Do we know what information we need to collect to give them the information? Think of something as simple as, do I turn my computer on or off? Do I unplug the server from the wall, or do I leave it plugged in? Those are steps that are included in this incident response plan that start with the policy and then are followed by the team. Great. So we've got this stuff outlined. How do we know it works? Well, these things have to be tested. Absolutely, positively have to be tested. Testing can be done in a couple of ways. One is we actually run through a practice test where we take systems down and we make sure that we can collect logs off of them, and we present these logs and make decisions off of them against a storyline. What is most often done, and is quite valuable, is just a walk through a tabletop test. So we get folks in a room and we present them with a scenario. For example, Monday morning, day of payroll, you come in and your payroll machine has a blue screen on it demanding ransomware. And before you pick up the phone and call the help desk, the next person over in the payroll department says their machine now has ransomware on it as well. What do you do next? That's a very simple question. It happens all the time. We've responded to 3 of these incidents this week. Jake has referred to responding to 1 this week as well. So what do you do if that happens? That is a walkthrough test. And in that walkthrough, you can begin to identify areas where maybe they're not sure, maybe something a little bit rough. We don't have the information that we need. And then you correct your plan based on that conversation.
Great. Well, Paul, we certainly appreciate your expertise on these couple of topics. I'm sure there'll be plenty of questions that you'll be asked later or after the webinar. But appreciate your time and energy today, and look forward to our next encounter.
Well, I appreciate you having me, and I look forward to it. Thanks, JP.
Thanks, Paul. Now, the last guest, ladies and gentlemen, that I'd like to introduce today is actually the compliance officer here at Etactics, Chad Trowson. Chad, how are you doing today?
Better than I deserve.
All right. Well, Chad, as a compliance officer, I know policies and procedures is a big part of your daily responsibilities. And we've talked, you could spend several webinars just discussing this particular topic. But, at a high level, let's talk about the requirements of HIPAA that healthcare organizations actually have policies and procedures in place. I mean, what does that mean? What are policies and procedures? And how can an organization develop a formal set, if they even need to have a formal set?
Yeah, so policies are typically referring to a high-level overview of what one wants to accomplish. Procedures are the steps to make that happen. As far as HIPAA goes, for that, we would look to the Federal Register, because that's where we find the actual law and what's required. So inside of the Federal Register, yes, JP?
No, go ahead, Chad.
Yeah. Inside the Federal Register, there's something called an implementation specification. These come in two major different facets. One is required, one is addressable. Addressable is much stronger than actually addressable. Doesn't mean you get the option of doing it. It means you have to do it or have a good reason not to, that you should document and follow through on a couple other steps.
So, Chad, what makes up a good policy?
Yeah, so when I think about policies, it's often how Paul was discussing his topic as well. There are major questions you should ask for everything. It's the who, what, how, when, why that you're doing something. So when it comes to policies, the who that you'd want to start with would be a clear scope. So this would be, what are the affected components that need to be acted upon? Is it an asset? Is it a workforce member? Is it an information system that something needs to happen to? Then the other part of the who is who's responsible for making that happen. So in HIPAA, most things end up ultimately being the responsibility of the security officer. And that's because HIPAA is designed to have the buck stop somewhere. Many areas assign teams, but ultimately you need one person to hold ultimate responsibility on it. Next up would be the what's inside the policies. So on this, best practices would be to draft something that has clear objectives of what must need to occur. And if at all possible, don't use terms of art or jargon or whatever you want to call them in your industry. The reason is you need people to understand what's going on. If they don't understand, they won't know what to do. The second is the how, and this is where the process ends up getting pushed into it. So you want, the proper steps that are to occur, or in some cases, not to occur, to bring the compliance with the policy alive. So that could be anything from telling employees not to click on the links in the emails that you referenced earlier when they're from a sketchy source. And that could be one of your policy objectives. The next part would be the when. So each policy should kind of tell you when it needs to happen, if it always needs to happen, the frequency, or if there are certain events. So when you talked about the offboarding of the lazy employee in your examples early on, during that thing, the idea would be that happens when you're offboarding an employee. And that would be part of the when something is to occur component. And then the final major component is the why. So this is where, in a good policy, it should tell you why you're doing this. So if it's in HIPAA, as we were talking about earlier, you'd want to point to the implementation specification. You might also want other informative references there, pointing to NIST or one of the other security frameworks. This would allow you to more easily see what needs to be required, because HIPAA is inherently made in a sort of vague way. It tells you something must happen, but doesn't give you the exact parameters. So for instance, we had an automatic lock screen policy that's mandated by HIPAA. The screen goes dead or it logs off the application. And some of our customer service representatives, when they were doing trainings, were having issue with this because they're not allowed to take control of the other person's device. So they're often watching and talking and directing. We had it set at 10 minutes, so when they clicked the button, they didn't move their mouse for 10 minutes, and everything went crashing. This set me down a little path of trying to figure out, well, what's the uppermost limit? So from going from HIPAA to NIST to other governmental paperwork, I found that 30 minutes can be supported for us to be able to do that. So we set their time frame for their devices to lock at 30 minutes, and I haven't heard any complaints since then. Now, those are the main parts of.
I'm sorry. Chad, just for time purposes, had another question related to kind of that sound policies. You know, proving that an organization actually follows the policies that they have in place, right, could be extremely difficult. Can you just briefly describe some of the methods that you've used to accomplish this here at Etactics?
Sure. So from everything from a time-stamped affirmation, we have a compliance solution that I utilize here. If you have any questions about it, you can put my email up and they can shoot me an email. And from that, you end up having that stamp saying it happened on that date. That would kind of be the lowest number of affirmation I'd want. Other times for HIPAA trainings, we require signed documents by the employees that I upload to their records inside our system. From there, it's uploading various reports that might be required. So if we need to show that we have 90 days of logs for people entering the building, I would go into the security system and download the 90 days and upload it. And I'd sometimes have that as evidence. What I like to do with these is to write out what steps I did, so in the future I don't have to think about it again, and there's more of that process in place.
Awesome. Now, Chad, moving on from policies and procedures, and I'm sure one of the components of HIPAA is talking about BAAs or business associate agreements. Chad, first of all, what is a business associate agreement?
So a business associate agreement stands for basically a contract between the covered entity and the business associate. The covered entity, in layman's terms, would be the producer of protected health information, the doctor's office, and the business associate would be the party that's receiving it or maintaining it or transmitting it for the covered entity's benefit that's not the patient. So Etactics itself is a business associate because our main line of work is claims and statements. So we receive that health information in, we process it, and we send it out somewhere. And
then what scenario, Chad, when does a healthcare organization need to have a BAA in place?
Yeah, so it's any time that they're giving it to a business associate that creates, receives, maintains, or transmits protected health information.
Okay. And in turn, how can a healthcare organization, obtain a BAA for their own use?
Health and Human Services had a general template that they put out around the time that the omnibus rule came out. That was the rule in 2013, I think like January 24th, that went into effect requiring all the BAs to be redone and the security rule to apply to all the business associates and a plethora of other requirements on it. So that would be a good place to start. If you're going around drafting, naturally you'd want to talk to an attorney and figure out where to go. There are a number of tricky items that have been popping into vogue lately, but we could dive into that in more detail on another webinar.
Awesome. Well, Chad, we certainly appreciate your time and energy today. Thank you very much for sharing this information. And obviously, to the audience, if you have any questions for any of our guest speakers, we'll certainly provide information to be able to contact us. We can facilitate those questions onto the appropriate parties. Now, we've covered 9 out of 10 topics today. The last topic that I want to briefly touch on before we let you go here is contingency operations. Now, Jake, Chad, and Paul have all talked about some of these items within their respective topics that they've covered today. But when we talk about contingency operations, you have to formalize these things. Meaning, do you have a disaster recovery plan? Is it real, tangible, something that is available to key personnel members within the organization in the event that any type of an incident were to occur, some type of a disaster, right? How are you going to recover from this disaster? If your facilities are compromised in some capacity, whether it's from even a terrorist attack or some type of natural disaster, whatever that could be, a power outage, if those facilities are compromised to where you cannot operate your organization's business operations within that facility, what is the plan? You have to have these things documented, because in the event that there is anything or any type of a disaster or an incident that qualifies as activating some of these contingency operations or plans, right? You have to have that documented, or else if you're not unable to continue your business operations, and there is some type of an audit, or maybe that disaster resulted in some type of a security incident or even a breach, right? What you need to have in place is a formalized plan to be able to deal with that. So this includes, incident responses, disaster recovery, emergency evacuation plans, business continuity plans. These all have to be formalized and documented so that you can produce that information and follow those in the event that there is any type of an incident that corresponds with one of these plans being activated. So that's the last thing that I wanted to touch on today. As I mentioned before, I want to thank again all of our guests, Chad Trowson, Paul Hugenberg of InfoGPS Networks, and Jake Wagner of Collabrance. If you have any questions, or if you find that you are sitting there on the other end of this webinar and some of these topics that we've talked about, your organization isn't meeting those requirements, please contact us today. We can provide you with some help and guidance so that you can fulfill these requirements and make sure that you stay compliant. Thank you for your time today. We hope you found this webinar educational. Be on the lookout for our next published webinar that should be released here pretty soon. I'm JP Cervo at Etactics. Thank you very much.